Hi, I'm Jaden, and I'm back with episode 2 of Living with CCI, Craniocervical Instability. This is my second video, and my goal here is to just tell my story. I'm hoping that it's helpful to other people. I do have many years of trying to sort out what was going on with my neck and my headaches, and so this episode, I'm going to talk quite a bit about the path to diagnosis, which was a long and arduous one for me. I'm also probably going to rant a little bit about the American healthcare system and its pros and cons, let's say. And in future episodes, I will get more into the living with CCI portion of what I want to basically this series to be about, is how you can kind of adapt your life and overcome some of the more difficult symptoms of CCI. Again, as I said in the first video, I don't have all of the symptoms, and I don't have some of the really bad symptoms. I don't have the brain fog or the vision issues or the dizziness or any of those things. So for people dealing with those, my heart goes out to you. I know that we all have a different presentation of this issue, and we each have to find our own path. So take what you want from what I have to say. It's just been my experience, but I think the diagnosis path is probably quite similar. I think it'll resonate with a lot of people. So I'm looking forward to telling the story about what I went through, and I'd love to see in the comments what things that have happened to other people as well, and different roads you've taken to finally get to your definitive diagnosis, which is where I arrived at late last year. So a little bit of background before I get going into it. So I started to notice some early symptoms in 2013, so that's exactly 10 years ago. It started with some mild but constant headaches that were really kind of a nuisance, and I wasn't quite sure what was causing them. I did notice that they were better when I was laying down, which is a common CCI kind of effect, that you get most of your symptoms when you're upright and you've got gravity trying to hold your head up, or you have to hold your head up against gravity. The other symptoms that I had were the occipital neuralgia had sort of started to happen. And I actually first, looking back on that, I'm like, when did that actually start? And what I remember about early occipital neuralgia, which I'll explain just for a second. So occipital neuralgia is the occipital nerve that runs from C2, and it innervates the back of your scalp. So the nerve it sort of branches out like a tree, and you get all these different little paths that it takes up the back of your head, and you feel sort of a tingling pain. Sometimes it can be sharp. In my case, it's more of a dull pain, and it's annoying. I mean, just because it's there and it's not supposed to feel like that. But it also does, I think, have something to do with the headache. So the neuralgia kind of has a triggering effect on the headache. So those symptoms I noticed about 10 years ago. I wasn't too worried about it. I just went about my life and carried on and just dealt with having a headache all the time. And the medical system really didn't know what to do with me. So I had tried a bunch of alternative therapy, chiropractic, massage, acupuncture, Feldenkrais. I tried some, really good personal training to try and strengthen the areas that I thought were weak. And I just carried on, and I became fairly athletic. I ended up getting into marathon running, and I ran my last marathon in 2018. So that's kind of the story I told in the last video. By the time I had run that last marathon, I knew that there was something wrong with my neck. I had a lot of joint pain and crepitus, the creaking and popping and grinding sounds that I knew wasn't right, and it was not there before. So this problem I had with the muscle pain and the occipital neuralgia and the now noises coming from the top of my neck, all of that was like, okay, this is a problem I need to take more seriously. So that's where I want to start this episode of Living with CCI show. And basically, yeah, I got an MRI at that point in 2018, and it showed that I had a C5-6 disc bulge, which initially I was kind of like, whoa, I didn't know I had a disc bulge. That sounds serious. As I later learned, it's actually a quite common finding in a MRI of somebody in their 30s or 40s or older. So even if you took somebody that was perfectly fine, had no symptoms at all, and you put them through an MRI machine, you might find a disc bulge, and it's completely asymptomatic. And so in my case, it was like, could this be causing my symptoms? Because it's really the only thing that the MRI found was that I had this disc bulge that was fairly pronounced. It could even kind of be seen in the x-ray. There was some loss of vertebral height or spacing between the vertebrae, 5 and 6. So that was identified as like possibly related to my issue. I also had a straight neck, which is generally attributed to bad posture over many years, which in my case, I ashamed to admit, but is probably true and probably was from years of bad, posture, doing desk work at a computer and laptop. And I used to do a lot of traveling for my job. And so I was, the ergonomics were restricted to whatever I could set up in sort of a hotel room type situation. So I was kind of going after this disc bulge, thinking, okay, like I probably have some disc degeneration. I need to like go after that, and then maybe my headaches will get better and all of that. So the doctor who ordered my MRI said that the first person that I should see would be a neurosurgeon. And I was like, okay, great. Like I'm going right to the top. This is awesome. I mean, in Canada, where I grew up, where I'm from, that would never have happened. Like going to see a neurosurgeon would be like months or years after you investigated every other possible thing it could be. And they would reserve sort of the highest level of science until you turned over every stone, so to speak. But anyways, I had this appointment with a neurosurgeon within, I think, about 3 months after the MRI. And I was excited about it, and I wasn't expecting to get surgery, but I thought like, okay, maybe he'll be like, yeah, dude, like this is the source of all your problems, and here's the things you can do, and this is, I'm going to recommend this particular physical therapist or whatever. Like I kind of went in there just thinking that he would know what was wrong with me, and if I just paid him, he would, send me on the right path, and then I could go back to running, and, my life would go on, kind of thing. So I was still in the phase of, going through the system that I still had some faith and some energy, I guess, to think positively about it. Anyways, I went to the appointment with the neurosurgeon, and he had the MRI on the screen in front of me, as often they do. And he showed me a couple things. He's like, yeah, you've got some little anomalies here and there. And it was, I don't know, it was kind of weird. Like he was just telling me there were these things that he saw, but basically there was nothing to worry about. Like he was just showing off or something. I thought it was a little bit strange. And then he sort of looked at the disc bulge, and he's like, yeah, like this is nothing. He's like, what are you doing here? And I'm like, well, I get these headaches like all day. And I've had them for years. I mean, because this is going on like 5 years now. So I am getting a little frustrated. So that's why I've come to your office, and that's why I paid, the $400 or $500 consult fee. Okay. So he's like, dude, go to my physical therapist. Like, this is like, don't waste my time. I mean, he didn't actually say don't waste my time, but I got the message that he was clearly, he didn't know what I was doing there. He didn't know why somebody would send me to a neurosurgeon because I had this minor disc bulge, and my symptoms were, not related. So he didn't explain that to me. I figured out later that the symptoms you would get from like a pinched nerve at 5-6 would be radicular symptoms, so symptoms down your arms, and if it was bad enough, you would actually lose some of your motor function in your arms and your hands. So if I was like dropping grocery bags like with no explanation and things like that, then they would start to be like, yeah, we might want to do surgery on that, and do a disc replacement or something. But I didn't have any of those symptoms, so he just sort of sent me to the physical therapist, which was good because I hadn't done formal physical therapy. When I was running, I was working with a really good deep tissue massage therapist. Was very well educated and was helping me take some of the tension out of the suboccipital muscles. The suboccipital muscles are running along the base of your skull that sort of control the nodding. And it's very common in CCI to get a lot of muscle tension up there because the muscles are trying to hold the top two vertebrae, together because the ligaments are too weak. So I had a good massage therapist, and I had a great personal trainer who had a master's degree and was really interested in trying to help me. But I'd never seen somebody that was trained as like a proper physical therapist. So I went to this neurosurgeon's recommended clinic, and there were three people, there were three therapists, I think, that worked there. And then there's this sort of army of younger people that are basically doing exercises with you. So it was interesting to kind of, and I'm sure everyone listening to this, well, maybe not everyone, but most of the people listening to this have been through this experience where you go to a physical therapist's office and you're basically spending 85, maybe 90% of your time with this person that has basically no training. They're kind of just like an exercise assistant. And I think that they use that position to get some kind of hours so that they could maybe eventually get into nursing school or something. There's some kind of requirement for them to get into a program they want. They have to do so many hours of clinical kind of work or something. I'm just basing this on what I've heard. I don't know if it's the same in every state or whatever, but they're really nice, and they're usually very young, like early 20s, and they just sort of teach you how to do these exercises that are prescribed by the physical therapist. So the physical therapist is at least, they're doing your initial assessment, trying to figure out what's wrong with you and then what exercise you need. And then the real work is done by these people that, are just kind of there in a revolving door of getting work experience, basically. So, but I had fun with it, and I did learn some, the chin tucks is a very common exercise that is given to people with CCI, and I've now learned that it's actually a terrible exercise to do if you have CCI, but sort of where you're trying to strengthen that suboccipital area by bringing your chin in, and there's different ways of making it harder to do that when you're laying on the ground, things like that. So I did the chin tucks, and I tolerated the physical therapy reasonably well. It didn't make me any worse. They also had some bizarre ideas about maybe it had to do with my running, and so they were trying to work on my hamstrings, and I'm sort of like, okay, my neck hurts, and you're working on my hamstrings, but okay. It is all connected. I mean, there's a concept called the anatomy train, where the fascia lines of the tissue are connected from the heels all the way to the back of the head. So, they were trying with me to figure out how can they make me better. They didn't make me worse, so that's good, because I believe some CCI patients are actually not only are they not improving with physical therapy, but they actually get worse. In my case, it was just kind of like a no difference. I did get a little bit of soft tissue work with the physical therapist, so they would give you, 10 or 15 minutes of massage, basically. And that was nice. I mean, that was worth whatever I had to pay for it, I guess. I was getting a sort of massage was included. And then, of course, they tell you, most of physical therapy is done at home. So you're doing the exercises while you're at home, and you have to buy different peripheral equipment to do all that stuff. So it got used to the, how to find things on Amazon and getting all the different little pieces that I needed I have a whole box of it now. Some of it I still use actually now. So that was my physical therapy experience. So it was interesting. It didn't really help me. And I think I kind of ran out of whatever my insurance was, included. And I just sort of like, well, this isn't really helping me. So, I stopped going. And then right around the end of that, the therapist had said to me that one thing I could look at would be regenerative medicine. I could probably do a whole episode on this, but I'll try to be brief about it. So anyways, on the sort of exiting out of physical therapy, at least for that particular calendar year, I got this seed planted in my head that maybe I should be looking at regenerative medicine because there were certain injections that I could get that, a neurosurgeon wouldn't offer. And I was like, well, that sounds good to me. Like if I could just get an injection and everything would get better, like, yeah, I'll pay whatever they're charging kind of thing. And well, be careful how you think about that because there are a lot of people out there that will offer all kinds of treatment and you just have to, it's buyer beware. So, okay. So next chapter of things was I did find a clinic that was very, established in the area in San Diego where I was living. And it seemed they were, had a number of years of experience. They did treat the neck and the back. Regenerative clinics do a lot of work with spine cases. So I made the appointment and I went up there. It was a fair ways from where I lived, just because, in SoCal, just because it's in San Diego means it was actually like almost an hour away from where I was living. But I went to the appointment and it was nice. The doctor was quite young, which is a little bit concerning because I wanted somebody with experience. Not saying he didn't have experience. He had a fellowship in pain management and he was an orthopedist. So he had the OD after his name, rather than the DO. OD, I think, is an optometrist. He had the DO instead of the MD, which basically the same training, but I think it's slightly different in the way they approach treatment. So yeah, I liked the guy, but he did seem a little green. He was a little young, but he talked me into trying a procedure, and they had essentially kind of a package of injections that they do, and this was all part of the Regenix network of clinics for regenerative medicine. So Regenix is where I spent most of my time and money. There are other clinics out there that Regenix is just sort of the biggest one as far as I could find, and they've done the most research that's available online. But it's still all experimental, and and they tell you that they don't mislead you. They sort of say like, here's some data that we have, and take what you want from it, but it's none of it is like double-blinded clinical trials. I mean, they may have some of that, but I haven't seen any published. I mean, if there are any out there, please comment and let me know, and I can correct that statement. But most of it is a little bit more anecdotal, and it's a lot of in-progress type research. But they're trying, and they're really trying to innovate. So anyways, enough. I don't want to make this an infomercial about regenerative medicine. And in the end, it didn't really help me, but I also don't blame them for it not helping me. I just think in my particular case, it didn't work for whatever reason. Maybe had more to do with me than with them. So, but I did a course of kind of regenerative medicine at a local clinic that had sort of generalized experience. They had no experience treating CCI. But of course, at that time, I didn't know that I had CCI. I just thought, like, I have a neck problem, and you guys treat the neck. And, they were happy to help me with that. So I had a bunch of PRP, basically. So PRP is platelet-rich plasma. It's a sort of a distilled version of your blood, for lack of a better explanation. They do a blood draw when you go in, and then you kind of go away for a couple hours, and they centrifuge the blood, and they separate different cells, and then they inject back in the portion of the blood that is the sort of healing elements of your blood. So you get a concentrated version of that injected into the area where you have problems. So that's the theory of how PRP works in a simplified way. And so I had a bunch of PRP, and I had I also had it treated the occipital nerve where I had the nerve pain, and yeah, and it was very expensive. I believe I paid about $5,000, so it was a lot more than the neurosurgeon I was complaining about earlier, who only charged me about $500, I think. But it was a lot of treatment. I mean, I was getting a lot of different muscles and structural supporting muscles in the neck treated with PRP, as well as 4 different joints. He did the 5-6 again because I had the disc bulge there, and then I think he also did 3-4 as well. And then he also gave me the occipital nerve injection, which was really just a very superficial, like close to the skin injection, just to try and bathe the occipital nerve in PRP. So one of the things that I later kind of learned is that essentially, like, they kind of went after the wrong area, because my symptoms that I went in there describing, and that, I later learned it's all originating from the top of the cervical spine, and that's not where none of the treatment was directed there. Why wasn't it? Well, I did have the MRI that was pointing them to do it lower, I suppose. And they also don't treat the upper cervical spine. So I think they were like, okay, well, your symptoms like don't quite line up with the lower cervical stuff, but your imaging shows that, and you've got a lot of complaints, so let's just treat your lower cervical spine and see what happens. So I think that's kind of what happened to me. So I got treated in the wrong area, in my opinion. And I basically didn't get any benefit from that particular PRP treatment. And I spent a lot of money. But I didn't know better. And, I don't blame, I think, all of these physicians that I've encountered. I don't think any of them had any kind of, nefarious intent or anything like whatsoever. I think they're all trying to help you, but they're limited in the capabilities of what they can do. And they're willing to try things on you as long as you're willing to pay. And so my advice to people is just be aware that these doctors may not have the capabilities to help you, but if you're willing to spend the money, I mean, they'll try whatever they have available. So if they offer, for instance, if you're getting treated for headache, they'll be like, oh, let's do Botox, or let's do this or that, or, all of those things will get offered. And I mean, it's one thing if that's covered by your insurance, but with regenerative medicine, all of that is cash. It's all in the US. There's really no insurance that covers regenerative medicine, except maybe some private insurance plans. But even then, it's probably really uncommon. So, yeah. So I had this procedure that really did nothing. But it gave me the contact with the doctor. So I guess of all of what happened in that experience, I was sort of inducted into the Regenix network. Regenix is a sort of center of excellence, I guess, in regenerative medicine, and they're headquartered in Denver. But they have sort of affiliate medical centers that are run by other doctors, and I think owned by other doctors, that sort of follow the same protocols, and they share research. So that's kind of how they're set up. So it sort of opened the door for me into this larger body of doctors. And as it turned out, the clinic that's the headquarters, which is in Denver, they treat tons of CCI patients. And so it was, going to that first doctor in San Diego. And then when I told him at my follow-up, like, dude, I didn't get any better. And I sort of reiterated, like, these are my symptoms. And he said, he's like, I think that you should really consider going to Denver and seeing the people there, because they can do injections like higher up in the neck, and you can't really get those like anywhere else in the country or even in the world. Like, it's an injecting the upper neck is really, really tricky. So he said that like you should really look into seeing the doctors at that clinic. So it gave me that, it sort of opened the door to that. So I did set up an appointment with the clinic in Denver and did all their intake paperwork and went through all of that again. It's like, again, if people listening to this video, how many times have you filled out the documents, like that, whatever, 4 or 5, 6 pages of regurgitating all your stuff, right? And it's like every clinic has their own format. And sometimes you arrive at the consult and the doctor hasn't even looked at the stuff. But anyways, I filled out all their stuff and I had a video visit with one of the doctors at the Denver clinic of Virginics. And he was really nice and really understood kind of what I was going through. And at that time, because I started to just become more educated about all this stuff, and I knew what CCI was, and I knew what the treatments were, and I said to him, like, I am pretty certain I have CCI, and if I'm going to come all the way to Denver, like, I want to be treated as a CCI patient. I don't want to be like, oh, let's try a little bit of this and see how you do, and then come back, and then try this and come back. And like, I want to actually get somewhere and not just sort of be, continually recirculated around. So he was really hesitant with that approach. And I understand why, because you want to be conservative in the way you treat a patient. Like, I get it. And you also can't trust that a patient knows what's wrong with them, which I get. Like, I can't definitively, at that time, like I didn't have the evidence to prove that I had CCI. That's what I thought was going on. And so he was very reluctant to offer me treatment as a CCI patient. So I kind of had to really think about, because I got a quote back from them, and I think it was for like another $5,000 or something like that. And it was more of the same. It was kind of demoralizing. Like, really, you're going to do my 5-6 joints again? Like, I just had it done in San Diego. Like, are you guys doing it well, they do a different, concentration of blood cells or whatever. Like, okay, well, this is a lot of money. So I was a little put off by having to sort of go through another round of more conservative, regenerative med stuff, and having to go all the way to Denver for it, and, which is not a big deal, but it's like, it wasn't offering me much new, other than that I would be getting a doctor who was really way more experienced. And he was going to also inject the upper cervical joints. So that partially was treating me as a potential CCI patient, because he was going to offer me the C01 and the C12 facet joint injections. But I was not going to be able to get the PICL, which is their sort of premier CCI procedure, which is where they inject through the mouth to get the ligaments that are actually damaged. So that was kind of what was there. And another thing that happened at the sort of at the same time as all this is I had this trip to Washington, D.C. For another purpose. And I had a friend there who said that he had an accident at work where something fell on him, like on his head, I think. And he was in physical therapy for a long, long time, and finally found a doctor that was extremely knowledgeable. And anyways, all of this was in sort of Arlington, Virginia, just close to the Washington, D.C. metro area. So I had this name of a doctor out there, and I'm like, okay, well, I'm going to be there for a week, and maybe I'll try to just, what the heck, right? Like, I'll go see this doctor there, and, if he knows so much about the neck. And it was even in network. So going about the U.S. healthcare system, insurance, basically, if you want them to pay for most of your care, like you have to stay sort of within your network. And when you have a really unusual problem like CCI, well, that's almost impossible. But this guy in Washington, he was in my network. So I'm like, okay, I'm making this appointment. I made the appointment, and I went and saw him. And he basically was, he was very knowledgeable, and I think at that point, like even just hearing my history was ready to be like, yeah, like, you know, you very, very likely have CCI. But the problem is that, you know, there's really not a whole lot you can do about it. So it was like I was hearing some honesty from a medical doctor who was not just trying to sell me whatever treatments they had on the shelf. He was really saying like, you know, there's not a lot of great options. He did tell me about the PICL, so he knew about that. And he said, you know, that it does appear to help some people, but it's very expensive for what it is. In his opinion, it is and was. And it's you know, there's no guarantee that it's going to work. And some people need multiple treatments. And, you know, these are at the time were like $10,000 each. So if you need like 4 or 5, 6 treatments, I mean, that's, you know, there's your retirement savings, or at least my retirement savings, because I don't have that. I didn't have that much. Having moved from Canada at age 30, I sort of had to start over again with my 401k and all that. So, yeah, so that was kind of sobering. Like, okay, I've got to be careful about, you know, how I plan this financially. But he did offer me some, I basically sort of the other next best option, I guess, for people looking for CCI treatment. And I think even the Denver people might, I don't know if they'd agree with this. You have to ask them, but like prolotherapy, I think is considered to be even within sort of the CCI, like educated CCI patient population, like prolotherapy in the appropriate joints helps stiffen the joints and just gives your spine a little bit more support and stability. And so anyway, so that doctor all the way out across the country was like, I can do prolotherapy for you and it's going to be like super cheap, but you have to come like multiple times, because his view of it was that prolotherapy builds on itself. And so I needed to come every 3 weeks for a period of a few months to get these injections. And he was, you know, he had a lot of experience injecting at the C1-2 level, which again, like even in Southern California, I couldn't really find anybody that would inject that high in the spine. So yeah, I was like, okay, well, instead of, you know, racing out to Denver, I thought I would try this sort of cheaper option where I believed that it was, you know, perhaps more he was more interested in my case than just making money off me. And so that's kind of why I opted to do the prolotherapy first. I think it was only about $400 a treatment. So, I mean, I spent probably less than $2,000 on all of the rounds, but I had to fly out there and I had to, you know, get hotels or Airbnbs or whatever. So like it still was an expensive treatment plan, and it did help me. I'll admit, like prolotherapy was provided a temporary benefit. And he definitely got into the right levels, because before he agreed to do this, the first round was a diagnostic injection with a temporary anesthetic, like lidocaine or something like that. So I, you know, went out to Washington, and he's like, okay, day 1, I'm going to do a diagnostic block, and then you're going to keep a pain journal, and the block will wear off after, you know, 3 or 4 hours. And then if that's successful, like if we confirm that this is where your pain comes from, then we'll go down the road of all these prolotherapy treatments. And so, yeah, so I was excited because I'm like, okay, here's a guy that's like really working with me, and it's not going to cost me a fortune, and, you know, whatever. It's still not covered by insurance, however, because again, prolotherapy is regenerative medicine and insurance doesn't. They don't cover that. So, anyways, I had the diagnostic block, and, you know, under the fluoroscopy and all that, which I had experienced before, you're kind of laying on this table with sort of like a triangular pillow under you. It kind of helps spread the vertebrae open, and then they literally just dive the needles in. Well, there's sort of a video X-ray machine going, and the way upper cervical is done is the x-ray goes through your mouth. And so they actually are seeing the joints in the back of your mouth with this x-ray machine that's sort of pointing up and going through you. So but what was so remarkable about that first diagnostic block, because I'd never had the 1-2 joint injected ever, was I felt it go into the joint, and I was like, yes, like that is the spot that has been bugging me for like 5 years. And he was right in there, and I'm like, this is like, okay, I'm in the right place. Like I'll fly across the country however many times you want me to. Like, so that was mostly on one side. It was on the left side. And my pain is pretty bilateral, or it's like equal on both sides, but I definitely felt the injection on the left, like really, struck a nerve, like literally, and it felt really good. And the one on the right also felt like it was in the right place, but it wasn't quite as, the hallelujah moment wasn't as strong. Anyways, but yeah, the diagnostic block was extremely successful in that my headache was gone. I felt just like completely wowed by this, 2 to 3 hour relief of all of my, pretty much all of the symptoms that I could think of were gone. Like there may have been residual things that I, just were masked by having everything else taken away. But it was amazing. So yeah, I went ahead with the prolotherapy, which unfortunately like only gave me temporary benefits. I found that in the, inner injection window, like in that 3-week window, I did feel better. He also had me wearing a hard collar for, I think it was like a week after each injection, because he didn't want me turning my head like this. He wanted me to like keep the C1-2 joint from pivoting. So I think possibly even just being in the hard collar was making me feel better, and the injections were doing nothing, but maybe the injections were helping a little bit, and I don't know. But I got through he did 3 rounds, and then we sort of took a break, and I was doing physical therapy with somebody he recommended at the same time. So it was a combined approach, which is another good sign. If you're working with a pain management person, you generally are, at least in my opinion, you want to find somebody that kind of has a team and doesn't pretend that they can fix everything by themselves. So this doctor had a PT, was also in Washington, obviously, but whenever I would go there, I would see his PT, and she knew exactly what injections I was getting, and she had treated people with upper cervical issues. So I got the exercises, and then I went home and I did them, and I did a little bit of video follow-up. And so, yeah, so that was kind of that was my first foray into really going into serious, treatment and spending money and traveling. And it felt good. I felt like I was really investing in myself, and, that this was going to go away. And, finally kind of found a doctor that understood and listened and had options, right? Like, and because it's one thing to go and just have and be listened to and acknowledged, but it's another when you have a doctor that actually has some options for you as well that make sense, that are potentially helpful for you. So yeah, after none of those working, that's when I decided that, okay, I guess I have to embarrassingly go back to the doctor in Denver and, be like, remember me? Like, I didn't sign on to your program like a year ago, and now I'm back, and, I'm sorry sorry I didn't believe you or whatever. So, yeah, I ended up getting signed up again with the folks in Denver, and because I knew that, that was another, the PICL was basically what I had to do next. Because there wasn't, like, after prolotherapy, there wasn't really anything else except the PICL, which is the ligament injections and with stem cells. And there's only one place in the world that does those. And so if you have CCI, I'm sure you're well aware. This is sort of the premier treatment in the entire world, and it's available in Denver. So, so I got set up there, and I had to do another intake, like another video visit, and sort of explain everything again, and really push to get the PICL, and they still wouldn't kind of promise to do a PICL on me, which I was just like, come on, like I've seen this other doctor, I have his reports, I have the diagnostic block, I have the report from it in the pain journal, and the doctor in DC had also done a sort of alternative X-ray. So this video is going to have tons of tangents, unfortunately, but one of probably the simplest and most effective ways of diagnosing CCI that a doctor will believe is getting a DMX. And the problem with the DMX is that there are really only a few around, and they're generally only at chiropractors' offices. They're, I believe, used mostly for like car accident, attorney kind of research, personal injury type claims and things so a DMX is basically like a fluoroscopy machine, like a video x-ray machine that's just turned on its side, and it allows you to do an x-ray of somebody while they're standing there and moving. And the x-ray is delivered as a video rather than just a bunch of still images like the traditional x-ray you'd get at the hospital or the medical imaging center or whatever. So the advantage of a DMX is that they can really look at the motion of the vertebrae, which is what CCI is all about. It's instability. It's a movement that's not supposed to move, or joints that aren't supposed to move as much as they do. And so getting a DMX is really, if you have CCI or you believe you have CCI, that should be the top of your list, in my opinion. And it's generally a requirement to qualify for the PICL, if I'm not mistaken. It's one of the things that they really look for. And there may be some alternatives now, like certain types of CTs or MRIs where you can move within the MRI machine or whatever. But the DMX is kind of has the most history behind it as far as the measurements and whatnot. So, but anyways, I had going like back from this tangent. I'm trying to get to convince the folks in Denver to like agree to a PICL, and because I just don't want to be jerked around. And this was when COVID was happening, so I'm like, I don't want to be doing multiple trips out there during the pandemic and risking getting COVID, and because there was no vaccine at that point. But I'm still I'm still in pain and I'm still trying to get treated, and so I still didn't have a commitment out of them. I mean, I basically was going back there to get the same treatment plan, including the 5-6 disc injection, or, the joint injections that I'd had like the year before that I sort of thought was kind of a waste of my time. But I was like, okay, well, I have to do this. I don't have very many other options. And if I do have CCI, I mean, this is where I have to be. So I just have to do what they tell me and suck it up and pay the extra money to sort of go through the motions and be like, okay, I'll do this. I'll get these injections. So I kind of went out to Denver, and I decided I would go for like a month because it was COVID. I was working from home and everything was cheap. Like the hotel was just like ridiculously cheap. So I'm just like, I'm going to go just like plant myself there. And I'm going to just be a thorn in their side. Like I'm going to try to get as much treatment as I can. So I went out there. I had a DMX done, which they have a DMX center that they work with right in the Denver area. And I figured it's like I'm going to get it anywhere. I should go to the place that they recommend. And he also happens to be, I think, the best in the business as far as doing DMX for CCI patients. So I had that, and then I had the in-person visit with the doctor at Regenix in Denver, and it was good. I did feel that I was taken more seriously in person. So another little takeaway for people that are going through this: the video visits are great because you don't have to travel and it's just less stress on your body and, you know, less risk of, you know, I guess COVID now is not as big of a concern, but still, you know, it's out there. But I think going in person makes a difference, and really explaining things when you're standing there in front of them, and you can kind of really not give up too easily, like versus the video visits when sometimes they're so rushed and they'll you know, I get it, like they allow a certain amount of time, but if they're running behind schedule, like then you're kind of, the end of your appointment is really rushed and you're kind of just pushed out, and it's not ideal, but going there is useful, and I'm glad I did. So basically I had that appointment. I was expecting to be told like, no PICL for you, like, you know, come back, you know, in 3 months and we'll think about it. And I was fully prepared to be turned down, but, you know, I had no options. And so I just told him everything, and he had my DMX at that point. So he looked at all that, and he, at the end, he was just like, okay, like, what can I do for you? And I'm like, oh, so I get to tell you what I want then. Well, that's great. So I was like, well, I just said, I want to know if I'm a candidate for the PICL. And there was a long pause, and he's like, yes, you are. So I said, great. Okay. So I'm here for 3 weeks, and I want to get this done like right now. Like I want to get it done while I'm here. And he's like, well, yeah, you should have not canceled your appointment, because he had booked me for that other procedure that I didn't want to waste money on. And I just I called the office and was like, you know, just take me off the schedule, because if he's not going to offer me a PICL, like I'm not going to just have more of the same kind of injections. So anyway, so he sort of, he scolded me a bit for canceling my place in the schedule. And he's like, but, you know, we can see you in like a week or 10 days or something. And I'm like, okay, fine. Like I'll, you know, that's great. Thank you, you know, for not abandoning me just because I'm a bit fickle and you know, fussy, I guess is, you know, I'm a tough customer is what I am right at that point. So yeah, so they fit me in, and I was, you know, I didn't even have to leave. I just stayed in Denver the whole time. And I think that I may have to break this episode into 2, because there's so much to talk about with diagnosis and treatment. But yeah, so like that, I think it's a natural kind of breaking point, because that was the first point in my entire journey when I really thought like my life could really change, when I was informed that I was going to get a PICL injection and that I probably had CCI, although he didn't ever formally give me that diagnosis. I was a candidate for PICL, which is what I had wanted for years. And so I finally was like, my God, like after all of this, right? And there's more to come. There'll be another episode like going through everything else I've done. But I thought that, you know, I had put in my time, and I'd done conservative stuff. I'd done the simpler injections in San Diego with the Regenix clinic. I'd gone and done the prolotherapy with the sort of mainstream doctor. And I'd had the x-ray evidence of what was going on in the neck with the measurements, and they were able to sort of classify me relative to other CCI patients. So yeah, so I thought like, okay, like problem solved. Like I have figured this out, and I've managed to convince the people the only people in the entire world that can actually address my problem. I've convinced them to actually give me the treatment, which was like, that felt pretty good. So, and not only that, but I didn't have to, you know, come back in 2 months or something. They were going to do it like a week later. So it was very exciting. And of course I forked over my $10,000 and got myself scheduled, and I got all of the things set up. So for people that are, you know, doing a PICL, I can just in closing, I just talk a little bit about what it was like to get the first PICL. I've had 2 in total, and then I was advised to stop. because they weren't working. They weren't hurting me. They weren't making me any worse or anything. I wasn't getting any benefit. And so, but anyways, I'll sort of wrap up just talking about the first PICL, and then I think I'll do another episode on everything that came after the first PICL and getting a really definitive diagnosis. So I can get to that in the next video. But yeah, so first PICL. So you do have to have that sort of in-person intake or whatever they call it with the doctor. So you have an office visit basically in person, and when you're there, and that's when they sort of finalize the specific treatment that you're going to get. And treatment meaning like what they're going to inject. So the doctor sort of sees you, listens to you, comes up with this injection plan, what they're going to treat, and then that is put into like a Excel table or something, and then when the appointment's over with the doctor, like you're whisked off to this area of their clinic where they have a bank of people. I think there's like 4 desks, and it's kind of like going to, like, if you've ever bought a new car, you know how at the car dealership, like you're out looking on the lot and you're seeing all these wonderful cars, and then you're finally ready to buy one, and then you're brought into this office and there's this sort of bank of little desks that have 2 chairs in front of each one, and so that's where you take care of business, and they take care of you, and they show you all of the costs. They do have some payment plan type systems, or you can just pay all at once, which is what I did. You also get informed about the post-op stuff, or I guess it's not post-op because it's not an operation, but sort of post-procedure things that you do get some medication, some pain medication that has to be filled at a special pharmacy because it's a narcotic. And if you don't live in Colorado, there's just certain rules about pain medication. So that has to sort of be organized. The other thing is, because I was out there all by myself, which is how I like it, frankly. I prefer to just, I'm a sort of a lone wolf, so I was out there by myself, and they do not let you go home from a PICL without somebody, which is pretty much standard for any procedure that involves anesthesia. So if you're getting a PICL and you plan to go alone, you will have to hire a at-home nurse type person, which is interesting because I was a little bit like, really, like I am, at the time I was like late 30s, and like I don't want some nurse like coming back to my hotel room with me, and like I just like I was like, okay, I will do whatever you make me do because I want to get this friggin' treatment. Like, but still, it was a little bit like, I don't know, like. But yeah, you have to hire this service that is really set up to help elderly people, but they also help people like in my situation where I needed somebody that would be there when my procedure was done and would drive me back to the hotel. They also will pick up medications on the way if that's how you want, and then they're, in theory, I guess they will stay with you for up to so many hours, and it's all included in what you have to pay. The reason I say in theory they will stay with you is because, as I found out, it's like it's a glorified Uber ride back to your hotel. Because unless you insist on them, staying with you, they don't have to. So you basically. It's just somebody that's there when you're done procedure that will drive you back, and they might help you carry your backpack up to your room, then they're done. I mean, they don't need to be there any longer than that. So, but yeah, so that's something to keep in mind. You do have to budget for that because it's an expense. It's an additional expense, obviously, so you. In the morning of your procedure, you have to fast because it's anesthesia. So it's like anything anesthesia, you have to fast so you don't choke on your own vomit, which would be a horrifying way to wake up from a procedure. So fast before the procedure. Don't ever lie about that. Not that I'm not saying I have. I'd never do that, but it's serious. Like, don't eat anything. And if you do, say something, because they'll probably postpone your procedure. So yeah, you go in, it's fairly early in the morning, and you get your bone marrow harvested first. So that generally comes out of your hip. And in my case, I was awake for it. I believe they will put you under or heavily sedate you if you wish, but it's not required. And I was absolutely fine. I mean, they numb the area locally. But I'd had injections before, like all those prolotherapy injections, and I was like, yeah, I think I can handle, some needles going in, and, it's... So that part was pretty easy, and they allow you to stay at the clinic while you're waiting for the bone marrow to do whatever to obtain the stem cells out of this bone marrow, which takes a few hours, and I'm sure the doctors, have a whole bunch of other people they see in between. And then, yeah, when everything's ready, you are, you're prepped for the procedure. You get a mouthwash that's designed to prevent infection, because, of course, the PICL is through your mouth. So one of the biggest risks of it makes sense, is like the mouth has all this food and saliva and, foreign bodies and things that are in your mouth, right? So infection is a huge concern with PICL. So you get this special mouthwash. They also give you some mandatory antibiotics after the procedure. Again, it's to prevent any infection. And in my case, I didn't have any infection, so they did a good job with me. And I think they have an excellent program, and I felt very safe there, and I felt very taken care of. And so yeah, it's a very comfortable operation that they have, and they do so many of these that I felt very confident about it. And then I remember, because of course around that time I guess I hadn't been anesthetized yet, but there's this thing when you have anesthesia where you sort of, the memory is a bit weird, and that you forget things that happened before you were anesthetized. And so I have this strange memory of the doctor coming in to the room I was waiting in, and it was just like, okay, we're almost ready. They're getting the room ready. And I remember this conversation, but it was very vague. And then he told me some joke about how, like, that he's like, oh, it's not like Victoria's Secret or anything, but you're gonna be in handcuffs or something. And I had this memory of him saying that. I'm like, it's so weird, but it makes sense, because I asked him the next time I went, I'm like, was that for real? Like, am I misremembering this? And he's like, oh no, because like, we don't want, like, if somebody happened to wake up from the anesthesia, which, they obviously hope never happens, but if you happen to wake up and you've got like a bunch of needles coming out of your mouth, like, they don't want any help, is what he told me. So you are tied to the bed. So, yeah, I mean, I think they just use zip ties or something, but so I had that strange memory about that particular comment. There's a mouthpiece that you have to have in that holds the tongue down as well. So I think I was asked to try some different mouthpieces. As far as I remember, the very first one worked just fine for me. And you get a little bit of Ativan or something as well, just to kind of chill you out a bit. And but yeah, I mean, it's general anesthesia, so you really don't remember anything from the procedure, and before you know it, you're on your way out with the at-home care nurse or your significant other or whoever's there waiting for you to be done. And I didn't have too much pain. They probably give you something in the IVs with the anesthesia to help with post-procedure pain. But yeah, it was a pretty easy procedure. And as far as I know, like you get like in my case, like I got a call the next day from the doctor just to sort of like, was everything okay? And he explained that the areas that were injected and any issues they had. In my case, like both the procedures I had went flawlessly from what I was told. They got all the areas they were going after in the ligament, and they also do the posterior injections in the back of the neck. again, because CCI is like a combined thing. It's the muscles and the nerves and the joints and the ligaments. And so all of that is getting addressed when you get a PICL, which is partly why it's so expensive. So that's kind of the story of the PICL. It was, quite a miracle to be informed that I was going to get one. And I was very excited to, experience the benefits of it, cautiously optimistic, maybe a little bit, hopefully optimistic. But yeah, it was a bit of a disappointment. And in my particular case, I really didn't see any improvements. If there were any, they were really limited to the first little bit. Like I did feel, I believe I felt a bit better for a month or so. And I say a bit better. It wasn't like I was cured. But after that, I went pretty much back to my baseline. And yeah, so in the next video, I'm going to talk about what happened after that PICL and some of the other things that I went through that led up to getting another PICL as well. So I'm already at an hour. So if you've stayed this long, I really appreciate it because, we are a pretty unique patient population, and I think we can all learn from each other. I hope that there's some experiences that resonate with people. I hope that there are people who are listening to this that are, looking for stories about, experience with PICL, because I would have benefited from having some information ahead of time before I went out there and kind of knowing what to expect. And again, I had the first one in 2020. It was like smack in the middle of the COVID pandemic. So some of the things may have changed, some of the procedures, or not the procedure, but like some of the office, flow and stuff like that might be different than what I experienced like 3 years ago. But it hopefully that'll give you an idea of what you can expect. And I definitely have some more to share about other things I've done besides just the regenerative stuff. So I'm gonna put that in the next video, and I will see you all then. So thanks again for listening, and please remember to like the video. It helps other people find it, and I'll talk to you next time.